I'm Father David. Welcome to Friar Time. We live in one of the wealthiest countries on earth, and yet for many Americans, getting sick feels like a financial death sentence. One hospital visit, one denied claim, and life can spiral into debt, despair, and disillusionment. But behind the headlines and horror stories, there are people, real people, working inside the system. People who, like the rest of us, are trying to make sense of a healthcare maze where compassion often collides with policy and greed. Today, we're sitting down with Connie Neeson, who is Director of Benefit Eligibility Management for Christian Brothers Services, Division of Consulting Solutions. Constance is a licensed social worker in the state of Indiana and has worked in benefit eligibility for 34 years. We'll ask the hard questions, the human questions, and hopefully find some understanding because healing isn't just about medicine, it's about compassion and care. This is Friar Time, so let's start talking. Welcome, Constance, and thank you for being with us today. Can you please tell us about your job in the field of healthcare? This would help us better with the questions that we're going to be asking, and how you experience interfaces with what many people experience in the healthcare industry.
Thank you, and thank you for inviting me to be here today. So my job is that I'm Director of Benefit Eligibility Management, and for the last 25 years, I've been working specifically with members of religious congregations to help them enroll in appropriate coverages for their health care, and that includes health insurance, also various programs and benefits, helping them navigate through the complexities
Mm.
of health care, and as with any other citizens, helping them to be able to obtain the best health care they are entitled to for their good health.
So, in other words, you would help a client get the best out of the program that they're enrolled in.
Correct.
So the healthcare industry can be very complicated and confusing, obviously. And Constance, can you please help us better understand some of the categories in this healthcare, such as, let's say, employment-based insurance versus Medicaid versus Medicare versus insurance in the marketplace versus Obamacare? It's really difficult to understand all of these various categories. So could you help all of us kind of better understand that?
Sure. One of the types of insurance that many people engage in is insurance through their employer. And as we would expect, many employers do offer that as a benefit, an attractive way to keep longevity for their employees. And that can cover healthcare, mental health, dental, eyeglasses, different arrangements depending on your employer. But um, those kinds of programs are usually comprehensive in that they cover the vast array of any kind of health situation a person might find themselves encountering. Usually, there could be a copay that a person has to pay when they go see the doctor, when they go to the emergency room. Often there's a deductible initially with that kind of health care, but there are many circumstances where people are employed, but their employer does not offer employment-based insurance. For those under age 65, an option that has been available recently is that they can purchase health insurance through the healthcare marketplace offered through the government. And that's at healthcare.gov, where
Is
they
that
can,
is that Obamacare?
it's what some people would call
Obamacare,
Obamacare.
ABC.
It's through the Affordable Care Act.
Uh-huh.
Yes. And so that's a way that people who don't have employment-based insurance can possibly obtain coverage for themselves and their families.
Now, I understand with Obamacare or that's pretty much a lot. There's like millions of people on that. Is that correct?
Yes, that's correct. It filled a huge gap that was not available for many people who did not have coverage, and really opened doors for people to be able to get the health care they need, to be able to get the medications they need. We know that being proactive and preventative
Right.
is wise health care. So yes, it really filled a gap that was necessary.
Can you clarify for some of our viewers may not understand the difference between Medicaid and Medicare?
Oh, I'd love to. So, Medicare is a program for those who are 65 and older or individuals who are disabled. It can also be for people who have end stage renal disease, kidney failure, or it can be for people who have amyotrophic lateral sclerosis, ALS, which we would call Lou
Oh,
Gehrig's disease.
right.
Those are the 4 ways you can have Medicare. So once a person is eligible for Medicare, they enroll. There are 4 parts of Medicare: A, B, C, and D. A is hospital care. B is major medical, so doctor visits, lab tests, um, diabetes testing supplies. Those are all Part B. Part C is what we call Medicare Advantage, and Part D is the medication part of Medicare.
Oh, actually, I never knew that whole breakdown like that. That's excellent. Thank you.
You're
That's very
welcome.
helpful. So now, what about Medicaid?
So Medicaid is a differently funded program. Medicare is funded through people contributing over the lifetime of their earning history.
Hmm.
And every time I get a paycheck, they take out money for my Social Security
Right.
and for my Medicare participation. And then it's partially funded by federal dollars. Medicaid is funded by federal and state dollars. There are actually, in most states, 25 different kinds of Medicaid. Some people think it's this monolithic
Right.
program, but there's 25 different kinds of Medicaid. There's Medicaid for pregnant women, infants, toddlers, families, working adults, and the age of the blind and the disabled.
Now, Medicaid, though, is dependent on income. Is that correct?
It depends on the program.
Oh.
Different kinds of Medicaid have different requirements and regulations. So, in fact, in my past, I was a Medicaid caseworker
Hmm.
for a period of time, and I had to know all the rules and regulations
Right.
about all those different kinds of categories. We call them categories of Medicaid. So, in my particular job, we mainly assist the elderly, so that's the part of Medicaid that I have the most experience with. But what people need to know is that if they are unable to afford health care, it never hurts to go and investigate whether there might be a category of Medicaid for which they could be
Well,
eligible.
well, speaking of elders, the elders, Constance, usually around December, there are many commercials about Medicare, supplemental insurance, Medicare Parts A, B, and even D. And I know that oftentimes makes people afraid. Do I have enough coverage? I know my mom called me to say, I'm getting these. Do I need more coverage? And
Right,
I think it's kind of a scare tactic to people who may be elderly who are not completely sure about what they're covered for and
right.
have a sense of what if there's a catastrophic event in my life, am I
Mhm.
covered for this? Can you help us better understand that?
Yes. So you're right that every fall, every 15 minutes or so, there's some kind of commercial on about you should sign up for this program or that program, and it can be very confusing. And that's usually around the Medicare Advantage or Medicare Part C
uh,
program. So, Medicare Advantage is a partnership between Medicare and private insurance companies. Medicare pays that insurance company a flat rate every month, and then that insurance company is responsible to pay actually all your bills. Medicare doesn't pay any of the bills in that scenario. The insurance company is in charge of paying your doctor, both the Medicare part and the supplement part, because we know Medicare doesn't cover everything. There's always
right.
some part that is a remainder amount. So um, when the doctor or the hospital or whoever provided the care, the physical therapist, sends the bill, they don't bill it to Medicare, they bill it to that health insurance company. What people don't realize is then that insurance company is in the driver's seat. So whether or not that service you need, that surgery, that procedure, that medication is approved or not is not up to Medicare anymore. It's up to that insurance company.
Oh, so this would be called supplemental insurance. Is that correct?
Well, the Medicare Advantage combines what Medicare would have paid
Mhm.
and a supplement in one package.
So if I don't have that other insurance company, then I pay for it, what Medicare doesn't pay for. Is that the idea?
So if you don't have a Medicare Advantage plan, most people buy what we call a Medigap or Medicare Supplement plan.
Okay.
So the Medicare pays its part. Usually, if you go in the hospital, Medicare pays all but the initial deductible.
Hmm.
If you go to a doctor, Medicare pays 80% of the doctor's fees, and there's a 20% remainder amount. So people usually will purchase a Medicare supplement to pay those remainder amounts
Okay.
beyond what Medicare will pay.
Otherwise, I pay.
Correct.
Okay.
Now, there are government programs that provide Medicare supplement.
Oh.
So then, if you qualify for those programs, you don't have to buy Medicare Advantage or buy a supplement. If you qualify for those programs, then it's free.
Oh. Do a lot of people know about that?
I don't think nearly enough people
Yeah.
know that that's available. You can be on full Medicaid if you qualify, and that acts as a Medicare supplement. Or there's a program called QMB, Qualified Medicare Beneficiary. That program has been around since Ronald Reagan, so the 80s,
Right.
and it's a free Medicare supplement if you qualify by your income and your assets. So QMB is a program we use a lot in my ministry to help people be able to have free Medicare supplement if they qualify. And you can go to any Medicaid office in the country and ask if you're eligible for QMB, and then it's a free Medicare supplement.
Wow. Did you hear that? There's so many of these programs that we don't know about, right?
Right. The other thing about QMB is when you are on QMB, the government pays the $185 a month for your Part B premium. So they stop taking that out of your monthly check. So we see an increase in the money that goes to that beneficiary every month so they don't have to pay their Part B premium. So it's a really good program.
So, Constance, there's a lot of frustration in the healthcare system. I think from all sides, not just from people who might be patients. So, can you walk us through what should be one of the common frustrations with our system is why even when a doctor says this treatment is necessary, the claim is denied?
Yes. So sadly, that's true. And it is very frustrating. A long time ago, health insurance was often provided through insurance companies that were not for profit. And therefore, the motive or the driving force was the patient care. In 1973, the HMO Act was passed, and we saw a migration to more insurance companies becoming for profit and creating HMOs. And then, because of that tendency in the healthcare industry, we saw that treatment was no longer just about what's best for the patient, but there was also a driving force in the insurance companies to have profit and, dividends for the shareholders. So that changed a bit the landscape of healthcare. So also, especially in Medicare Advantage, we see that because Medicare Advantage has now given the driving force of the healthcare over to these health insurance companies. So under Medicare Advantage, we see it quite often in my practice that things that normal Medicare, what we call traditional Medicare, would have approved, are denied because of the cost of what that care will be, and it's going to eat into the profit.
Now, if I can just, these treatments, okay,
Hmm.
uh, where does the pricing come for these kinds of treatments? I mean, we hear about people being in the hospital for 3 days and it's $150,000.
Yes.
Well, where did so in some instances we blame the insurance companies. On the other side of the coin, some of the pricing for hospitals or treatments or even
Right.
medicine is just so outrageous.
So the cost of healthcare is a balancing act between the cost imposed by the provider,
Hmm.
hospital, doctor, clinic, whatever it is, and what the insurance companies are willing to pay. So there's what we call a negotiated rate, where the hospital, and let's say Blue Cross or United Healthcare or all these different health insurance providers, and in Medicare and Medicaid, they go to each provider and negotiate. The hospital may say, well, if you have a broken arm, we're going to charge $5,000, but the insurance company might say, well, you can charge what you want, but we're only going to pay you $1,000.
Okay, right.
So we have negotiated rates for different insurance systems, and then because of those negotiated rates, the providers have to have a profit as well. They have salaries and people to pay and equipment and costs and all of that. So it's a balancing act between those.
Right.
But you're right that in recent years we've seen skyrocketing healthcare costs. And one thing that drives that also is people who go to the hospitals or go to doctors and have no insurance. And therefore, the hospital may have to eat that cost if that person can't afford to pay privately. And that has to be absorbed by the rest of us who do have insurance paying higher costs.
Okay.
Now, I will say when the Affordable Care Act came and Obamacare, more and more people having insurance means that hospitals are not having to eat as much cost. And so therefore, it is not driving increasing costs as much. So Obamacare was good for all of society because it means all of us have less medical costs
Right.
because more people have coverage.
So the cost is shared.
Yes.
I had the experience of being in the hospital in January, and I remember the gentleman in the next bed. They came in and asked him. They said, "You have no insurance," and he said, "No, yeah." And so they said, "We're going to have to ask you to leave."
Well, that's unfortunate.
It was very unfortunate. Yeah. Luckily, he had already had all of his tests, and so he was going to be discharged. But yeah, I was. That was the first time I've ever heard actually someone be removed from the hospital like that.
Yes.
Yeah,
Yeah,
it
I
was,
believe sadly that happens, especially again, we know that there are not-for-profit hospitals. Many of them actually run by Catholic agencies,
Right. Yes. Yeah.
and before there was ever Medicaid, before there was ever Medicare, the care for the poor and for people who didn't have insurance, a lot of that was provided by,
Right.
Catholic
Catholic
health
yep.
systems.
Yep.
So, but there are places that are government hospitals or not-for-profit hospitals where they won't ask people to leave. They
Yeah.
will provide the care.
Yeah.
So,
Constance, do you believe the average patient understands the fine print in an insurance plan? And do you think we should be expected to get our magnifying glasses out and read all that?
it is such a complex system to navigate in this country. The answer would be no. I think many people, highly educated people, very intelligent people, when it comes to their health care, are baffled by how to make it work, how to get the care they need, how to make sure the bills get paid by all the various health insurance providers. And that's part of what we do. My team in Indiana, where our office is, I have 14 other people who work on our team. And a big part of our work is helping the people we minister to navigate how to get bills paid and how to get approval when doctors order things and procedures or tests or surgeries and they're denied, how to go through the appeal process. There's a system called prior authorization. And how do we help people navigate getting a denial overturned or appeal that denial? So it is very complex.
Does it have to be that complicated?
Well, most first world countries, most developed countries don't have it this complicated because they have a one-payer system. And my hope would be someday that maybe we would be able to navigate that in this country. I don't think it has to be that complicated, but it is that complicated.
Right.
That's
Right.
the truth.
I know, like people have said to me, well, in these, I brought that same thing up. This idea of what's in the United States and what's in these other countries, and they said, yeah, but you have to wait hours, or days to get help in these other countries.
Well, let me just tell you, in this country, you have to wait for care too.
That's
I
exactly
know,
right.
I personally needed to see a cardiologist. I needed like in May, and it was like November or December before I could get worked into their schedule. So there is that complaint that sometimes in countries where they have a single payer system, you may have to wait for care, but that problem is here too.
Yeah.
So just because I have health insurance through my employment, it's good insurance, but you have to wait till you can get in. Dermatologists are the worst.
Oh,
It
yeah.
can take like a
It can
year
take a year.
to
That's
get in to
right.
see a
Yes,
dermatologist. So, we have that same problem in our current system,
that's
the
true.
fact that you have to wait for care.
If you could change one thing about our claim system to make it more user friendly, what would you say?
Well, one thing I would like to see is I wish that the prior authorization and appeal system were more transparent, more easily navigable
Hmm.
by individuals because again, if a person, their doctor says you need this surgery, you need this treatment, and it's denied, people think that's the end of the story, and they
Right.
don't know how to navigate the appeal. Usually, the doctor has to be intimately involved, and I see on social media all the time, medical providers, they spend hours on the phone trying to track down who within each insurance agency they could talk to say this person needs this surgery, they need this medicine, they need this treatment. And quite often the doctors are also very frustrated at trying to navigate getting the care that they know their patients need. I wish that were more transparent, and I wish the appeals process were more transparent. And the third thing is, quite often the person denying the treatment is not medically educated.
Yeah.
They're not a doctor, they're not a nurse practitioner, they're somebody that was hired to increase the profit margin.
So do you think that the people that say that if I call up to get a claim, do you think that these people are trained to immediately deny because of the profit motive?
I think we see some of that.
Yeah.
We see some of that where they hope you're going to let it go and just
Right.
drop it
Yeah.
and not pursue appeals, not try to drill down to who has that authority. I have seen where some doctors on social media will say, I want to know your medical degree to the person doing the denying. And they're like, well, I don't have a medical degree.
Yeah.
Okay, then I need to talk to someone who has a medical degree
Right.
because you don't know what you're talking about.
Right.
So I think doctors are having to become more proactive and advocate for their patients in a way. But to say to someone, if you don't have a medical degree, I'm not going to accept that denial, you know.
That's a good point. I never thought of that. So, Constance, what would you say to someone right now who's watching who has felt betrayed by their insurance company?
So, in every state, there are certain agencies that can provide assistance. There's the state health insurance program, and there's also the senior health insurance information program. And those programs have a contact. I think we're going to put it on the screen where
Hmm.
you can go to the website and look up in your state where you can contact them for information about getting assistance with your insurance. And also, every state has an insurance commissioner. And that insurance commissioner, again, there's a website for that. You can look that up and get assistance if you have a complaint about your insurance. They're not serving your needs correctly.
Oh.
And so there are resources to reach out and get help to try to advocate for getting your insurance to pay for the care you need.
So, if I'm denied a claim, there are all these resources I can go to
Right.
continue
I'm not
pursuing
guaranteeing that
this.
you will get that
Right, but
claim approved, but it's worth pursuing appeals, prior authorization, and the assistance at the state level.
sure, because some of these are life and death situations. Yeah.
Absolutely.
Yeah.
Absolutely.
If you could dream out loud for a moment, um, what does a truly compassionate, fair, and human centered healthcare system look like?
Well, if I could dream, I would dream that in this country we would have a single payer system. Every other developed country has done that, and they make it work. There ought to be a way for us to make it work. And providers need to be paid their just amount
Yeah.
because they are valuable in our system. Um, We also need, though, to take care of the care needs of all of our citizens. Everyone should have the health care they need. And so in my mind, eventually we need to come to a single payer system.
Could you explain what a single payer system is?
Well, some of the legislators who have talked about this have talked about Medicare for all, for example, or one system where everybody can have access to care regardless of whether they're employed or not employed, regardless of their financial situation. I think those who have financial resources should pay something for their medical care, but we need to take care of people who don't have resources.
So, in a single payer, does that mean there will be no insurance companies?
Possibly,
Ah,
or maybe the insurance companies would somehow be worked into
supplemental.
that system, but it would be fair compensation for everybody, fair costs for everybody. Those who have more resources should pay more. Those who have no resources should get the health care they need still. So, and I think as a society, that's our responsibility
Uh-huh.
to take care of everybody in a just society.
Thank you. Today, we've gotten a glimpse behind the curtain, so to speak, into a system that so many find confusing, overwhelming, and at times heartbreaking. And yet, even in the middle of all that frustration, there are people like our guest Constance here, who's trying to do what's right from within. It's easy to feel powerless when bills pile up and calls go unanswered, but here's what gives me hope. The growing number of people, patients, doctors, legislators, and those in the industry who are beginning to speak out, to push for change, and to remember that healthcare is, above all, about care. We are not helpless, we are not voiceless, and we are not alone. Real change begins when ordinary people on both sides of the system dare to ask, can we do better? And the answer is, I believe, yes. We can do better, we must do better, and by the grace of God, we will do better. Until next time, let's stay grounded in compassion, guided by justice, and moved always by hope. I'm Father David, and this is Friar Time. To explore eligibility for health insurance options, go to www.healthcare.gov. Each state has programs in place where citizens can seek assistance in finding insurance options or in seeking redress for their medical care needs. For those under 65, each state has a State Health Insurance Assistance Program, SHIP. This information is available on the internet at www.shiphelp.org. For individuals over age 65 on Medicare, they can call the Senior Health Insurance Information Program, SHIIP, in their state for assistance with understanding Medicare, Medicare Advantage, Medicare supplements, and Medicaid options. For a state by state list, go to www.cms.gov /about CMS /contact /database and select the SHIP option for the list of contacts in every state. Also, each state has an insurance commissioner. Citizens can go to the website for the National Association of Insurance Commissioners, NAIC, at www.naic.org.